This article relates to an aspect of the case study surrounding osteoporosis-associated fractures. In the case study, we see a 75-year-old woman with osteoporosis who subsequently falls and breaks the neck of her right femur. Fractures of the femur, the distal radius, the proximal humerus, and those of the vertebrae are most commonly associated with osteoporosis. This research study was conducted on all residents living in Rostock, Germany, over a one-year period, in an attempt to determine the actual incidence of the four types of fractures most commonly associated with osteoporosis in advanced age, by direct comparison with retrospective analysis of fracture counts. The study found that retrospective methods of fracture registration provide inaccurate fracture counts and do not elicit sufficiently reliable data, which is necessary for devising health-relevant strategic approaches and making expenditure forecasts in healthcare. The study also discovered that women, like the patient in the case study, especially those ages 45 and older, were shown to not only have a significantly higher rate of fracture compared to men, but they also had a significant increase in the frequency of femoral fractures from the age of 60 and onward. Although there are four main types of osteoporotic fractures, it was interesting and surprising to find out that the peak incidence of femoral fractures occur in advanced age and exceed the rates of all other types of fractures investigated in this study. On top of that, women were not only more likely to sustain a femoral neck fracture, but once they turned 90, their risk and frequency of fractures was a staggering 28.5-fold higher than it was at age 60.
Study the relationship between bone mineral density, demographics, knowledge of osteoporosis, beliefs concerning osteoporosis, and preventative behaviors of at-risk females with family histories of osteoporosis was studied. Most of the subjects had been exposed to osteoporosis-related information. However, few had a clear understanding of osteoporosis. At-risk women had reasonably accurate beliefs regarding prevention. However, few had adopted preventative behaviors. This study provides evidence that bone mineral density is strongly correlated with a combination of knowledge and behavioral factors. However, females with a family history of osteoporosis reported that strategies to prevent osteoporosis were difficult to implement. As nurses, we should educate at-risk women about osteoporosis and various preventative behaviors that they can engage in to reduce the impact of perceived barriers in access to health care. In addition, nurses should attempt to develop effective prevention strategies for women with family history of osteoporosis to protect the health of these vulnerable populations at risk for developing osteoporosis. This study found that high-energy trauma was the cause of femoral neck fracture in the minority of young patients. This contrasts with previously reported information that encompasses the majority of the literature. This lack of congruence between findings could be attributed to the variation in frequency of traffic accidents between countries, which are a major cause of high-energy trauma. Another reason could be due to the variation in the prevalence of osteoporosis around the world. On another note, it is possible that the differences in trauma mechanisms are caused by increased osteoporosis with increasing age and/or by reduced lean body mass, which might increase the tendency to fall in middle-aged patients. Likewise, the majority of the young patients had good physical health, whereas the middle-aged group had higher morbidity and were taking several medications that could have been related to their increased risk of hip fracture. According to the World Health Organization, 30% of postmenopausal white women could be affected by osteoporosis. Something interesting that this study found was in reference to using quantitative ultrasound as a first-line osteoporosis screening tool. The QUS has the potential to be accepted as a valid and practical method for public osteoporosis health screenings. This study also found that osteoporosis rate increases with age and has a strong correlation with the duration of menopause. Likewise, multiparous women were at higher risk for developing osteoporosis most likely due to the inadequate calcium intake during pregnancy and breastfeeding. In addition, the age of menarche proved to be significantly older in women currently diagnosed with osteoporosis. Another interesting finding pertains to caffeine intake. Caffeine increases urinary calcium excretion for at least 3 hours after consumption and has been associated with some evidence of altered bone remodeling. Smoking also has an increasing cumulative negative effect on bone mineral density. Bone mineral density actually begins to decrease by approximately 2% every decade after menopause in female smokers. In conjunction with smoking, excess alcohol intake appears to have an adverse effect on the preservation of bone mass, mainly by suppressing bone formation. Lastly, the study discussed how hormone replacement therapy prevents the reduction of bone density related to postmenopausal hypoestrogenism by preventing perimenopausal decrease in radial and vertebral bone mineral density. To begin, I found this systematic review article on the genetics of osteoporosis to be quite challenging to comprehend. However, it did provide good insight into the future surrounding the genetics of osteoporosis and subsequent medical advances. This systematic review breaks down multiple genome-wide association study designs that pertain solely to the identification of osteoporosis loci that will hopefully serve to provide insight into the pathophysiologic mechanisms surrounding the disease. Clinically defined largely through bone mineral density, osteoporosis and osteoporotic fractures have reasonably high heritabilities, which triggered considerable effort to identify the genetic determinants of this disease. Genome-wide association studies have recently provided rapid insight into the allelic architecture of this condition, identifying 62 genome-wide significant loci.